Welcome to Confidentiality training. The Oxford Dictionary defines confidentiality as intended to be kept secret. All health employees are required to keep information about patients and their healthcare confidential. Aside from special circumstances, privacy laws covering access to patient records require that only healthcare employees can view and share this information for the purpose of providing care. The information is kept secure to prevent unauthorised access or misuse. Keeping this information private is both a legal and ethical requirement of your role. There is state and federal legislation governing the confidentiality of patient information. The main two acts covering patient confidentiality in New South Wales are the Health Records and Information Privacy Act, which is a New South Wales Act of Parliament, and the Privacy Act, Commonwealth. It should be noted that there are other laws that govern privacy and confidentiality, but the two aforementioned are the main statutory pieces that we need to abide by. These two sets of legislation impose similar obligations on private care providers. However, it could be argued that the New South Wales legislation has a higher compliance threshold, meaning that a healthcare practitioner complying with the New South Wales legislation will generally also comply with the Federal Act. Sometimes we can breach a patient's confidentiality inadvertently or whilst trying to do what seems to be the right thing at the time. The following two examples are quite common in the medical environment. In both scenarios, the patient's confidentiality has been seriously breached. Please watch the video and think about where confidentiality laws have been breached.
I've got someone from Sedgworth on the phone for you. I'm sorry I didn't catch your name. She's on line 2.
Hello, Marilyn Perry.
Hello, this is Staff Nurse Hudson from Sedgworth General A&E. We're just admitting a Mrs. Dora Templeton, a patient of yours, and she seems a little confused about her medication. Can you just confirm exactly what she's currently on, especially the dosages?
Just bear with me and let me have a look. Sorry, our computer's really slow today for some reason. Oh, here we are. Warfarin, 2 milligrams daily, coproximol, 2 tabs PRN, atenolol, 50 milligrams daily, bendrofluozide, 2.5 milligrams daily. That's the lot.
Thanks a lot, that's a real help.
No problem.
Bye.
Bye.
Hello, East Collingwood Health Centre.
Hello, I'd like to find out the results of a test I had done at yours the week before last.
Okay, can I have your name and date of birth, please?
Nadia Croft, 12/4/89.
Okay, that's 65 Bedford Road.
Yes.
And it's about the chlamydia test.
Yes.
Okay, right, it looks like your test results have come back from the lab, Nadia, but I don't have the details here. I think it's best if you book an appointment with Dr. Turner. It looks like you need a review on your Marvelon anyway, so you might as well kill two birds with one stone. Would you like to fix an appointment now, or would you need to check with someone first?
No, I can make the appointment.
Okay, Friday at 3?
No, I don't get out till 3:30.
Right, 4 then?
Okay.
Okay, let me just put that in. So that's Nadia Croft, 4 o'clock, Dr. Turner. That's done? Okay then, bye.
Bye.
The first scenario depicts a hospital contacting a private care facility requesting information regarding one of their patients. How could this call have been handled better? The second scenario depicts a patient contacting a private facility requesting results of a recent test. How could this call have been handled differently? Whilst performing our role, we must be constantly vigilant in ensuring each and every one of our patients' privacy. At no point should we ever leave a patient's file or referral in a place where the information can be read. We should never leave a patient's electronic file open on the screen, nor should we ever discuss a patient in an area where the conversation can be overheard. We need to be vigilant at all times that we are not inadvertently breaching patient confidentiality whilst carrying out the normal parts of our job. We also need to make sure that we are only accessing the information absolutely required to fulfil our job requirements. At no time is it acceptable for medical staff to read a client's medical file without authorisation or an appropriate reason, randomly search client databases for familiar names, or access information on family, friends, or co-workers. It is very important that whilst carrying out the duties of your role, that you are not reading any information that is not pertinent to the task at hand. Simply extract the information absolutely required to complete the task effectively. Under the Health Records and Information Privacy Act, there are severe penalties imposed on individuals and companies who have been found to have breached someone's medical confidentiality. These fines can range up to $40,000 for the company or $10,000 for the individual. As part of our legal and ethical confidentiality obligations, your practice has a privacy policy that can be requested at any time from Russell. Additionally, all staff have signed confidentiality agreements upon employment. If you are unsure of what that agreement included, a copy can also be requested from Russell.